Now we'll look at major forms of cardiovascular disease. Coronary artery disease is when there is insufficient flow of blood to the heart to meet its needs. It commonly results from arteriosclerosis. Arterio refers to arteries, sclerosis, hardening of the arteries. What happens when the arteries are hardened is that blood flow can be obstructed, and if the heart isn't getting the blood it needs, the essential nutrients and oxygen that are found in the blood, then you can develop a heart attack. This picture A represents a clean blood vessel. There's no plaque or fatty deposits building up. B shows the beginning of plaque building, and C shows that a lot of occlusion is occurring. A lot of blood flow is getting cut off as the opening through which blood can move gets smaller and smaller. Atherosclerosis is another name for plaque buildup. We have arteriosclerosis, which is hardening of the arteries, and atherosclerosis, which is the plaque that builds up inside the arterial wall that leads to this hardening of the arteries. And by the way, something else that hardens your arteries? Smoking. So don't smoke. This is cocktail chatter for those of you that are interested in cholesterol numbers. Please share it with your friends. The numbers that are recommended for total cholesterol, HDL or the healthy cholesterol, LDL or what I call the lousy cholesterol, and triglycerides, a type of fat that is measured when we're looking at what's called a lipid profile, when you have blood drawn to check for your cholesterol levels. In each category, I have highlighted what's considered high. So a blood cholesterol of greater than 240 is considered high. With LDLs, you can see what's considered high and very high. With triglycerides, you can also see the numbers there. Now, with HDL, for men and women, the healthy cholesterol, if it's under 50 for women and under 40 for men, that's considered risky. Again, I'm not asking you to remember these numbers, but this is information that sometime you may have your cholesterol numbers checked. You will have an idea when you go back and look at this, what those numbers are supposed to be. There are a number of other factors involved in assessing cholesterol risk for heart disease, but these are some of the basic guidelines that are used. The thing is, half of all heart attacks and strokes occur in people with normal blood cholesterol levels. So there's something else going on in 50% of the folks who are having heart attacks and strokes. Let's have a look at the process that's going on in the blood vessel that can lead to occlusion or heart attack and stroke. Again, heart attack is when the blood flow is being cut off to the coronary arteries that supply and drain the heart, and stroke is what occurs when blood flow to the brain is cut off. What we're looking at is a person who's already had some plaque buildup in this blood vessel wall. There's a purplish layer that represents scar tissue. Imagine, if you will, that there's been an injury to this blood vessel. We'll talk more about that in the next couple of slides. But as you know from when we discussed the immune system, that if you cut yourself, your body's response is to form a scab. Over time, the scab will fall off. What we're looking at is scar tissue that's formed over plaque. For some reason, there's been some kind of injury to the blood vessel wall where plaque has built up, and that could be from high blood pressure, which we'll talk about. On the right, the vessel on the right, you can see that blood is still flowing, that its blood flow is not being impeded. In the lower picture, for some reason, that scar or scar tissue ruptures. That signals the immune system that something is wrong. What happens is a clot begins to form. This is saying that the plaque contains fat, cholesterol, proteins, calcium, white blood cells. All these things are what go into making plaque that build up in the blood vessel wall. When the scab part is ruptured, it signals the immune system that something is wrong. What happens, and as a response to the chemicals being sent out from this rupture, is the formation of a clot. Platelets are beginning to form. They build up as they try to heal this scab, and a clot is being formed. If the clot forms to a point where it cuts off all blood flow, then that person can experience a heart attack, a myocardial infarction. That's when blood flow is completely blocked in the coronary artery. Let me just review quickly what we looked at. We were looking at a blood vessel that already has plaque buildup, that's already had some type of injury, and so some scar tissue has formed. And then for whatever reason, it could be high blood pressure, that injures the blood vessel wall as the blood is flowing through it at a higher pressure than it can be handled over time. It could be high triglycerides because that can lead to thickening of your blood and that can injure the blood vessel. For whatever reason, this scab broke. It triggered an immune response that brought platelets to form another scab, or another, in this case, a clot that blocked off the blood vessel. And in this example, that was a blood vessel to the coronary artery, leading to a heart attack, or, since we like to use lots of syllables, a myocardial infarction. This is another cross section of an artery wall with plaque building up. Let me review how this happens. So plaque forms, as we just looked at, when the artery lining is damaged. There's cholesterol. We looked at a number of different things that can form the plaque, including white blood cells and protein, as well as cholesterol. It moves into the artery wall and it begins to accumulate. Because the immune system sees this injury to the blood vessel wall as something that's not supposed to be there, just like if you cut yourself, your immune system would also result in forming a scab. These immune cells, the macrophages, we talked about these big eaters, consume the LDL cholesterol and create foam cells that also penetrate into the arterial wall. The foam cells release chemicals causing irritation and inflammation. Inflammation is part of your immune response. That plaque grows and becomes covered with a smooth lining of cells like a hard pimple. I guess that's what the previous slide recommended. I said that it was a scab. I guess this example would kind of relabel it as a hard pimple. Both of them aren't pretty to think about. What I want you to realize is that plaque buildup occurs as a result of injury to the blood vessel wall. At the top of this blood vessel on the left, a clean vessel wall, probably only looked that way when you were born. Over time, there's that injury to the blood vessel, attracting immune cells, prompting inflammation, causing accumulation of fat moving into the artery wall and leading to plaque formation. So we have plaque formation, we have inflammation, we have the blood flow being cut off to the heart. At the bottom of the slide is a link to a video that I have online for you to look at that shows you, I think in like 25 seconds, how this occurs. But what I want you to understand and what I want you to remember is that it's the inflammation that leads to blood vessels becoming occluded as a result of plaque building up. And that is what may be occurring in 50% of people who have heart attacks. There may be no other warnings. There are no other ways of measuring it because their cholesterol levels are normal. Actually, let me take that back. There is a blood protein called C-reactive protein, or CRP, that is a marker of inflammation. The thing is that it's not very specific for inflammation in blood vessel walls. It could mean that you have an abscessed tooth, and that can be causing inflammation. There's a more specific blood test using C-reactive protein that may be related to plaque buildup and inflammation in the artery wall. But this is a case where we may have a test that can give us a result, but we don't know how to bring those blood levels down. So C-reactive protein, a marker of inflammation. Myocardial infarction occurs as plaque builds up. That fibrous cap or scab covers the plaque. A heart attack occurs when this cap ruptures. Platelets accumulate in that area of damage and can lead to blood flow being cut off when up to 80 to 90% of a blockage occurs. I just realized I've reviewed this for you like 3 or 4 times. I think it's pretty important, and I'd like you to understand the steps that lead to a heart attack. And I would say that this particular slide here sums it up pretty nicely. Heart attacks are not always painful. I know on television you see the person grabbing their left arm and suddenly they fall on the ground and they're having a heart attack. But the reality is not all heart attacks cause pain. As people age, particularly females, the symptoms of heart attack are not always obvious. They're less noticeable in the elderly and in females. Video that I have posted about our gentleman having a heart attack. and then come back and see what else we have. Angina pectoris is a type of heart pain that comes from progressive narrowing of the arteries. People who've experienced this describe it as a strangulation of the chest. There are different types of angina. There's what's called stable angina, and this is a type of chest pain that arises when someone is exerting themselves, like if they're doing exercise, if they're climbing steps. It's due to partially restricted blood flow to the heart. Stable angina is something that can be controlled. If there's medication that people can use, and you can live for a long time with angina as long as it's the stable form. However, unstable angina is when this strangulation pain occurs when someone is at rest. A person experiencing unstable angina must go see their doctor. What you need to know is that it's not the same as a heart attack. Although unstable angina certainly increases risk for heart attack, people can live with stable angina on medication, but unstable angina, they have to see their doctor. Another type of heart disease is hypertension. It's also known as silent killer because it doesn't really have any symptoms. Hypertension is another name for high blood pressure. About 90% of the cases are what are called idiopathic hypertension, which simply means that the cause isn't clear. What happens is that the blood pressure goes up. We'll talk about what those numbers should be in a minute, but if the blood pressure rises, the pressure at which the blood is moving through the arterial walls can damage the walls over time. Hypertension can thicken the arterial wall and damage it when it is sustained over long periods. So for example, when I'm having trouble making a video and things just aren't going right, my blood pressure may go up, but it comes back down. A lot of people's blood pressure goes up and down throughout the day. That's why hypertension isn't diagnosed with one single reading, but it's when blood pressure goes up and stays up that it becomes a diagnosis and can increase risk for heart disease. When it goes up and stays up, it can damage the arterial wall, and that leads to the inflammation that we talked about a lot and increased plaque buildup. Blood pressure is measured at 2 points. If you've ever had your blood pressure measured, they give you 2 numbers. The first number is when the heart is measured when the heart muscle contracts. That's the higher number. It's referred to as the systolic blood pressure. The second number is when the heart muscle relaxes in between beats, and that's called the diastolic blood pressure. That's the lower number. While I'm not asking you to remember the range of blood pressures, what I do want you to know is systolic blood pressure is measured when the heart is contracting, and diastolic blood pressure is when the heart is relaxing, and that hypertension means high blood pressure. These are the guidelines as of November 2017. I don't need you to remember all of these numbers. I do want you to know that an optimal blood pressure is less than 120 over 80. Less than 120 over less than 80. It's measured in millimeters mercury. Again, you don't have to know that, but I need to put it in there for completion. I have down at the bottom no more pre-hypertension because that used to be a diagnosis. Now they've changed it to elevated hypertension. This is when you have the systolic between 120 and 129 and a diastolic of less than 80. It's not something that would be treated with medication, but I guess it's a red flag. It's something that your doctor would want to keep an eye on. The DASH diet, more than 75 million people in the United States have high blood pressure or hypertension. Not all people need to be treated with medication. One treatment that may work for mild hypertension is something called the DASH diet, the dietary approach to stop hypertension. This was a study. These were the results from a study that showed folks that consume 9 to 14 servings of vegetables and fruit each day were able to lower their blood pressure as much as people on medication. Now remember, this was for mild hypertension. Please don't tell your family or friends to go off their meds and start eating lots of vegetables and fruits. Well, you can tell them to start eating lots of vegetables and fruits, but they should not go off their medication if they're taking meds for hypertension. It's something that they should do under the supervision of a registered dietitian and their doctor. The DASH diet showed that it wasn't only sodium that can affect blood pressure, but that the minerals that are found in fruits and vegetables, calcium, magnesium, potassium, that these can have an effect on blood pressure. It may not be that we're getting too much sodium in our diet, but that we're not getting enough potassium and the minerals found in vegetables and fruits. People get a lot of their sodium, their dietary sodium, from packaged processed foods. And when you're eating lots of fruits and vegetables, you really don't have much space for all those ultra-processed foods. That may be a benefit, that while you're eating all these vegetables and fruits and getting the extra minerals, you're not getting the extra sodium. The DASH diet, the dietary approach to stop hypertension.